Hey everyone, with Dhanisha, it's me Nigel from LangFort International Academy, and we are back with a new roleplay video for you. So today the setting is at the hospital where a person has been scheduled to undergo a surgery, but he has some concerns, especially regarding the general anesthesia, and he has some doubts that need clarification. So donning the part of the nurse will be Dhanisha, and obviously I will be the patient. So without further ado, let's move on to the video.
LangFort International Academy. Your passport to the world of opportunities.
Good morning.
Morning.
I'm Dhanusha, one of the registered nurses working in this hospital. Am I right in thinking you're Mr. Christopher who is being scheduled for the surgery today?
Yeah, that's true. I'm Christopher and I'm supposed to undergo a surgery later on today.
Okay, Christopher, how are you feeling about the surgery?
Well, look, I'm quite anxious about the surgery, especially I'm worried about the general anesthesia because I've heard lots of unpleasant things about the general anesthesia, the possible side effects mainly.
Okay, Christopher, that's a reasonable concern from your part. I can definitely explain that to you. General anesthesia is a procedure in which certain medicines will be given to you before your surgery, just to make sure that you don't feel any pain and you'll be in a relaxed state of mind throughout the procedure. Is that clear?
Yeah, that's absolutely clear to me.
Okay, well, moving on to the procedure involved, general anesthesia will be administered to you in the operation theatre by an expert anesthetist who will ensure your safety throughout the procedure. And there are hardly any complications involved except for the chances of mild and temporary side effects like nausea, chilling, and sore throat. Please don't worry about all those things because it will be very well taken care of by our expert doctors and nurses. Do you get my point?
Yeah, I do get your point.
Okay, Christopher, in order to ensure the easiness of the procedure, will you be able to answer a few questions based on your general health conditions?
Oh, certainly. Feel free to ask me anything.
Okay, thank you so much, Christopher. I'll start right away with my first question. Have you got any sort of allergy?
Oh, not at all. I do not have any kind of allergies.
Okay, well, that's noted. And secondly, have you got any dentures?
Oh, not at all. No kind of dentures.
Okay, no dentures. And finally, are there any general health conditions that you have?
Oh no, I do not have any health conditions. In fact, I am in a very good physical state right now.
Okay, Christopher, thank you so much. I'm glad to hear that you don't have any serious health issues so far. Before getting into a further discussion, may I summarize your responses to my question?
Sure.
Which are no allergies, no dentures, and no any general health issues so far. Am I right?
Yeah, that's correct. But sorry to interrupt you. Why are you asking me all these specific questions?
Oh, I can definitely explain that, Mr. Christopher. It is imperative to get accurate information, especially on these allergies and dentures, before taking the general anesthesia, just to make sure that there are no any possible consequences during the procedure. That's why I asked you all these questions. Okay.
Yeah, fair enough.
Moving on further, I would like to bring into your notice a couple of pre-surgery instructions. Is that okay?
Yeah, okay. Let me go ahead.
Thank you. There are restrictions on your food and fluid intakes. To be precise, you're advised to follow fasting for 6 hours prior the scheduled time of the surgery, and fluid intakes are allowed only up to 2 hours before the procedure. Is that okay?
Yeah, that's okay.
Okay. In addition to that, you will have to change into the surgical gown, which will be provided from the hospital before entering into the operation theatre. Do you get my point?
Yeah, I have no issues with that.
Okay. And for the recordical purpose, Christopher, could you please tell me the exact time when you had your last food and fluid intake?
Well, I did have a quite early breakfast today, somewhere around 6 a.m.
Okay.
And also I had a glass of orange juice during that time. After that, I have not taken anything at all.
Okay, well, that's perfect for the surgery. And are there any other concerns you would like to discuss on?
I guess no. Everything has been well addressed.
Okay, I'm glad that I've addressed all your concerns. In that case, Mr. Christopher, are you ready to give the consent for the surgery?
Of course, I do have no kind of issues with the surgery. You may go ahead with it.
Thank you so much, Christopher. Let me reassure you that general anesthesia is commonly given to all the patients before their surgeries, and there are hardly any complications involved in the procedure. In case of any discomforts or difficulties, please don't worry about that because we have an expert set of doctors and nurses to take care of you. And moreover, you will be in the observation just to make sure that you comply with all the medicines and treatment following the surgery. Okay, until then, stay positive, take care of yourself. Thank you so much for your cooperation. I'll be seeing you shortly. Thank you.
All right, that draws to the conclusion the role play video. So let us know what you thought about the video by just dropping your suggestions in the comment section. And as usual, do not forget to like, share, and subscribe. Till the very next time, it is Dhanisha with Nigel signing off. Take care. Bye bye.
Bye.